going to share a little bit about aging and in the spine. And the talk basically is on aging and its effects that we see in people. How does aging occur in the spine? Basically, does aging cause lower back pain, and what are the pain generators that we see in the lower back? Standing balance and aging and its effects. Sarcopenia, what exactly is it, and how do we manage it? So as we all know, aging is a process that we all undergo with time. Okay, so as I was saying, aging is a process one undergoes with time, and healthy aging is actually aging gracefully. However, all of us undergo mechanical stress, and together with very poor muscular strength and physiological change, there is, however, some problems that come about with aging. Now, lower back pain is actually one of the most common problems that I see in my clinic. And actually, it not only affects the old, it also affects the young. However, the majority of patients do have mechanical back pain, which means pain that comes on with movement. And usually, these do go away by about 6 weeks in 80 to 90% of people. But, okay, the red color part, there are certain things that we need to pick up and certain groups that do require additional evaluation by your doctor. So what are these group of people? So patients that actually present with red flags, which are all the things in red that you see on the screen right now, acute back pain that actually prevents sleep or wakes you up from sleep, or night pain that we call, any pain that accompanies weakness or numbness in your legs, or if there are new bladder and bowel disturbances that you actually do experience recently, namely either constipation, increased frequency, or complete loss of continence. Other signs that are disturbing and known as red flags are signs like fever, sudden weight loss that is non-intentional, as well as loss of appetite. Any history of injury or trauma is vital to be known to your doctor. And of course, if your back pain's been there for years and getting worse, it should be evaluated by your doctor. Now, what is important to know is the spine is a very complex part of the human body. It comprises of various different bones and discs. It is of 3 different parts. In the neck is known as the cervical spine. The middle back is known as the thoracic spine, and the lower back, the lumbar spine. Basically, between the bones, there is a cushiony support known as the disc. It is held together by joints and ligaments, and it helps to go against gravity and allow us to walk upright and transfer these biomechanical forces to functional activities. But because of all these, therefore, the spine is very prone to degeneration, loading, and wear. Now, how does aging occur in the spine? This is a very common question I get in the clinic. They will say, how is it that I'm only 16 or 17, I have aging? Well, actually, aging occurs within the first decade, and this usually starts at the disc level. So if you look at the picture on the screen, basically it shows how the entire degenerative process occurs. Basically, there is a gradual loss of nutrition or nutritional supply to the disc as the bone around the disc starts to thicken. As such, the water content then decreases and you have what we call a black disc. Other than usual aging and biomechanical aging, is there anything that makes aging faster? I think these are some of the things that potentially can make the disc worsen quicker. One, of course, is smoking. We do know in smokers, they tend to have worsened aging and changes. 2, if there is increased loading on the back, either in terms of heavy body weight, this results in a lot of stress over the joints, disc, and bone. And lastly, if one engages in any sports or occupation that puts the spine at repetitive stress, it does make your disc degeneration go faster. Other risk factors we have seen globally across the population are things like genetics. So in certain groups of patients within their family history, multiple people within the family have very early onset of disc degeneration. So these are things we can't change, but at least we can know. and then we would try to remove the rest of the risk factors and therefore try to slow down this aging. So this picture shows what exactly happens when you have a degenerate disc. In the picture showing the white color disc on the left-hand side, basically it shows the normal loading force on the spine. When the disc becomes black color because of loss of water, you notice that the percentage of force goes to the back of the spine, resulting in increase in facet arthritis or wear and tear in the joints, as well as tear in the covering of the disc, and therefore a slip disc can potentially occur. I'm going to go into a little bit about how and why pain can occur in the lumbar spine. Now, lower back pain can be divided further into acute, which is usually less than 3 months, and chronic, which is more than 3 months. Most patients in the clinic do present with purely acute back pain, and only a small percentage progress from acute to chronic. Pain generators can be from the bone and joint itself or within the disc, or in certain group of patients can be a global cause, meaning due to a change in the balance of the spine. Now, this is a pictorial that shows what are the potential things that can happen in the various parts of the spine resulting in pain. Starting with the bone, I think you can see that whenever there's fractures or any growth, it can cause pain. 2, if there's any changes in the joints, you can cause facet pain, for example, arthritis or inflammation. 3, from the muscles, you can myofascial pain. 4, from the nerve roots, if there's any compression, you can result in nerve root pain, weakness or numbness. And lastly, from the disc itself, from a discogenic pain from wear and tear or from a slip disc. I'm going to go a bit into the bony structure after we've discussed the disc itself. Now, osteoporosis is a common problem, especially since we do have an aging population in Singapore. And what exactly is osteoporosis? Well, there's a definition by the World Health Organization. Basically, it is a skeletal disorder. It affects the whole skeletal structure or bony structure. And basically what we see is a low bone mass per unit volume. There is a loss or deterioration of the microarchitecture of the bone. And because of this, the bone cannot sustain loading and they are easily fractured. According to World Health Organization, we use the bone mineral density test, and the T-score of less than negative 2.5 is defined as osteoporosis. Those with a T-score of minus 2.5 plus a fragility fracture does have severe osteoporosis. So in terms of osteoporosis, there are also various different kinds. The ones that we see in the elderly are normally primary osteoporosis, of which it is due to aging or degeneration. In women, most commonly it's known as postmenopausal. In men, senile osteoporosis. However, in the younger group, if they have multiple medical issues, or if they do have chronic renal failure, chronic use of steroids, they also can have osteoporosis, but this is defined as secondary osteoporosis. This is a picture that can clearly show you what a normal bony structure in the spine versus one in osteoporosis. As you can see in a normal healthy spine, the bone microarchitecture is very thick. It is of very nice trabeculae, whereas on the opposite side, you see a very holey sort of bony structure. And because there is a thinning of the bone trabeculae, we are unable to load on this bone, and therefore it is at increased risk of fractures. Knowing the risk factors for osteoporosis or fragility fractures is very important. So I think this slide, if you do have any of this, is important to take note. Then you can have a further consult with a physician or specialist to at least ascertain via a screening test or bone mineral density test with regards to whether you have osteoporosis. So what exactly are the risk factors for fragility fractures or osteoporosis? Number 1, if you have a family history. 2, you already have a previous fragility fracture. A fragility fracture is defined as a fracture that occurs with minimal trauma, okay? And if you have low body weight, you are quite elderly, you are losing your own height of more than 2 centimeters over 3 years, if you have undergone early menopause, which is defined as menopause younger than 45, you do have diseases that can lower bone mineral density. If you take not enough calcium, you do not have enough exposure to sunlight, you have excessive alcohol intake, smoking, or if you have an increased risk of fractures or not moving around well, all of this puts you at increased risk of osteoporosis or at risk of fragility fractures. So this slide basically explains a bit about fragility fractures and where they are commonly seen. So as mentioned, we can see osteoporotic or fragility fractures in the spine. The other areas that we see is in the wrist, more commonly in elderly when they fall on outstretched hand and they present with a wrist fracture. Others from a fall or without a fall is in the hip, pelvis, and as well in the shoulder, in the top part of the humerus. These are usually can occur with minimal trauma or impact, and commonly seen in patients with low bone mineral density and of a slightly older age group. So spine fractures, as mentioned, are more common in 2 locations. One is in the middle back or thoracic spine. The other is in the lower back or lumbar spine. Most commonly, they are what we call compression fractures. So what are they, right? So basically, on X-ray, we see the front part of the bone being compressed with a loss of height. These are usually stable, and they can just present with back pain with or without injury. We usually would diagnose this with X-rays or MRI or both. Treatment can be with bracing. I think you have seen some of the, if you have come earlier about the brace that Glenn shows you. So that's one of the modalities that we use. We can use a rigid brace, especially in fractures of the thoracic spine. In the lower back, sometimes we can use a shorter rigid brace as well. If, however, the pain continues despite bracing and analgesia or painkillers, sometimes we do have to go to more invasive means in the form of cementoplasty. I will just talk about cementoplasty earlier, but this is a short slide about how do we diagnose a fracture in the lower back. So as you can see on the X-ray, the arrow kindly pointed out the small little reduction in height of the front of the bone. The other one on MRI is clearer. It shows that there is presence of edema or fluid in the bone, and this means that this is a new fracture, okay? This one is actually an intraoperative picture. It's a picture of cement injection or cementoplasty as mentioned. This is something that we undertake, especially if the patient still has a lot of pain despite bracing and is not able to function daily. This is usually where we put a needle in under X-ray guidance. We inject cement. So in this setting, the cement acts like a grout. Like when you build a house and you stick the bricks together, this is exactly what it does. This cement is in a liquid form. So what it does is it goes into the fracture and like a glue holds the fracture fragments together and therefore helps stabilize the fracture and reduce pain. This is a very busy slide, but it is one of the, I would say, tools that we use, what we call a FRAC score. This FRAC score is actually globally used. It is also unique to each individual country. All your doctors would likely be using it, be it your GP or specialist. What we do is we will go to the country involved. For example, on the picture, we'll go to Singapore, and then we'll use this calculation tool to calculate and stratify your risk for a fracture, and thereby this will determine how we will treat you based on the FRAC score. This is also a very busy slide, but basically this is a treatment algorithm that we use in Singapore, which is recommended by the Ministry of Health. I think what's most important is the circled part. I think with regards to treatment, your doctors will usually start treatment after discussion with you. But what is most important to note is the need for all of us to A, correct calcium and vitamin D. We can do it on our own with simply a change in diet by increasing dairy products or with supplementation, and for vitamin D to increase your time out in the sun to at least about 30 minutes a day. Lifestyle changes is also an important part for treatment of osteoporosis, which mainly is exercising, doing weight-bearing exercises or weight training. This is a slide as to show how does degeneration occur. You can see bone spurs in the joints. You can also see bone spurs around the disc and disc degeneration. All of these will translate to this picture. So this is just to show you when we look at x-rays and you're having a discussion with your doctor or GP in the clinic, what exactly are we trying to show? So the normal x-ray is the one on the left-hand side. Right-hand side is the one that shows degeneration. And basically, when we look at x-ray, we're essentially looking out for the various things that you see. One, we look for any bone spurs. Two, we look for any change in the disc height, which is the cushion in the spine. Three, we look for any enlargement of the joints in the back, which all points to degeneration or wear and tear. Sometimes, because of nerve symptoms, weakness or numbness, your doctor may also recommend doing MRI. And this picture shows the difference between a normal versus a degenerative spine based on MRI. So on the MRI on the left-hand side, it shows what we call spinal stenosis. So I think you can see the space for the nerve is now very much reduced. On the left-hand side where you can see the long noodly things, those are the nerves that can be seen very clearly. Two is in the picture or label A, you can see the discs are all black in color, which means that this is degenerate. Lastly, we are going to talk a bit about balance, posture, and ergonomics. So I think I'm actually trained in degenerative deformity, and I actually work with the French, so I shall quote Frenchman Dubussy. What's important to note that as we all stand, there is actually a position whereby we can stand with minimal energy expenditure so that we can stand straight and look forward. This is what we call the cone of economy. So Dubussy says that once you're in the center, you can balance yourself properly, you can do most activities without using much energy. However, if you start to degenerate, there's any changes in the spine, and you're outside of the cone of balance, you generally will need use of a stick to help you maintain balance itself. So how do we assess balance in the clinic? We generally do a head-to-toe x-ray, what we call a EOS. This is actually a new low radiation system to see the spine balance. And compared to the old system of old scoliosis x-ray, this has less than half the radiation dose. So for young kids who basically are followed up quite frequently for scoliosis to see how curved their spine is, this is actually essentially a very vital tool because we do not want to increase risk of cancer in the younger group of patients. So this picture actually shows what happens when we have aging and how our body will try to compensate, especially when there is presence of a fracture. So in picture B, the arrow points to a fracture in the thoracic spine. So because of the fracture, you start to become very, very hunched. And what happens is your center of gravity now becomes more forward. In order to prevent one from falling forwards, we tend to pull back and tend to further bend our knees to achieve better balance so we can look forwards. Which is why sometimes in the elderly, despite not gaining weight, they do seem to have a very large tummy, and this is because of a compensatory mechanism in order to prevent themselves from falling forwards, and they stand basically like this. Okay. Yeah, so they can't stand straight. Now, is there such a thing as too much aging in the spine or otherwise? This is going to be the last part of the lecture where we're going to talk a bit about sarcopenia. Okay, so what exactly is it? So basically, sarcopenia is derived from two parts. Okay, it's from the Greek word sarx, which means flesh, and penia, which means loss. So essentially, it is a loss of both muscle mass and strength, and therefore a loss of general function. Why does this occur? So globally, we are seeing that there is a general aging population. The graying population is due to better healthcare and, of course, a declining birth rate. But the importance of sarcopenia is that there is actually an increased disability, meaning you lose function, you may be in a wheelchair, and there's also an increased risk of death, which overall is a huge financial burden for the younger population. At the same time, this is associated with osteoporosis and complications of fragility fractures. Therefore, I think it's important to start to identify and start early treatment as possible to prevent all these complications. This picture is not, I think it's fairly common if you walk around the streets. And these are all actually symptoms of sarcopenia and related conditions. Basically, the person on the left-hand side, right, she's very hunched. However, she's still able to stand upright and look forwards. The lady in green, basically the person there, who is, I think, a delivery person, has totally lost the ability to maintain balance, and is actually using a push cart, which is outside of the cone of balance, and therefore, these patients generally will have quite a fair bit of chronic pain. So we do have multiple criteria to diagnose, but I think essentially we look for muscle mass, muscle strength, and physical performance of the person when we look for sarcopenia. And these can be done by using hand grip meter strength, as well as a whole slew of physical examination in the clinic when you go and see your specialist. Now, in the community, one easy way to find out if you are at risk of sarcopenia is using the SCAR-F questionnaire, which later I'll flesh out. But I think what is most important in this algorithm is an ability to first identify. So if anyone's within what is mentioned up there, that means if a person has recent functional decline, a loss of weight, frequent falls, malnutrition, as well as chronic cardiac lung problems, renal impairment, all these people do have risk factors for sarcopenia, and they should be reviewed so as to find out whether they truly can be diagnosed or are sarcopenic. So this is the SCAR-F assessment that we talked about. It is actually an important questionnaire, can easily be done by your doctor or by yourself, and a score of more than 4 is actually a positive result for sarcopenia. And usually, if that is the case, we would recommend seeing your doctor for a further evaluation with a test to find out truly whether you are and to start treatment early. Finally, this is a paper I saw, and this is very close to home. This is a study published in 2021. This is called the Yishun study done by Duke-NUS Hospital, and it actually looks at sarcopenia in Singaporeans. So, number one. So they actually looked at 542 people, and in this group of people, 30% of them, or 32.2% of them, have sarcopenia, and these are usually in the above 60 age group. However, the younger age group are also not spared. In the 21 to 59 years old, 32.4% are found to have low muscle mass, and 14.1% of them have probable sarcopenia. So they did say that within this Singaporean group, what are the risk factors for this? Similar to the global risk factors, things are low BMI, poor nutrition, older age group, a higher waist circumference, whereby there's much more fat within the muscles, patients who take a lot of alcohol, and chronic diseases like diabetes, hypertension, and cholesterol, all put them at increased risk of sarcopenia. So then what can we do? Is this something that we can actually make a difference ourselves? So there are 2 things that can be done. So 2 factors that can be changed are 1, nutrition, and 2, physical activity. In terms of nutrition, it is advised to have adequate protein intake, especially high branch chain proteins or whey protein, adequate vitamin D level, just as mentioned just now, minimum of 30 minutes of sunshine per day. And the amount of vitamin D that we normally would take as supplements is 1,000 international units per day. As for physical activity, it is recommended to at least do moderate intensity with resistance training. This is a recommendation by the Italian sarcopenic group, and this is what we will encourage everybody to do. If you do aerobic exercises, you need a minimum of 5 days per week, and basically at moderate intensity. If you do resistance training, minimum 2 days per week, again, slow to moderate, and these are all the other recommendations that they do have. Finally, I will end off with 2 of my cases that I did, basically showing complications of sarcopenia. So case 1 is a 60-year-old lady. She has low bone mineral, she has low BMI, she's very underweight, and she has very chronic lower back pain. I think you can see from the pre-operative picture, she's severely hunched. Her tummy is quite prominent, and that is a response to her poor musculature, and she has tried to compensate, but she has failed. She basically did physiotherapy for a year, still had severe pain, couldn't walk very long, and this is what we did for her in the end, and she's quite happy post-op. Case 2 is a patient who is also in her 60s. This is a lady who presented to us in the hospital with very unstable osteoporotic fracture. So from the CT and MRI, I think you can see one of the bones is completely flattened, and the one above is squashed. And it is also compressing on the nerve at the thoracic region. She was unable to sit, nor even stand. And at the end of the day, we had to go in, remove the fracture, put in a bone strut, cement the screws, and stabilize her spine. So all in all, I think it's important to highlight that problems like sarcopenia, osteoporosis are important things to manage and identify early so that we have to prevent and come to this kind of complex surgery. Lastly, on a side note, these are some of the spine health screening that we do in alpha joints. This is so as to keep our patients healthy and active as they age gracefully. With that, I thank you. With early menopause, you can already start to do that. So once you have quite a few of those risk factors, and you think that, hey, I think I am quite a high risk for that, then you should be going for a bone mineral density test. But in general, for both normal primary osteoporosis, in women, usually after menopause, then we would start recommending doing 1 BMD. If they are not osteoporotic, then generally you don't need to repeat unless you get any of the symptoms we mentioned. For men, usually they are in the 60s to the 70s, that's when they get some degree of osteoporosis.
Thank you, Dr. Fong. Now, there's a lot of questions, so I'll pick some of the ones that are very relevant. Okay, this one is pretty good. What can I do about my posture if my back starts to compensate due to degeneration?
Okay, so that number 1 is first we need to find out why you are compensating. Is it due to an acute fracture, or is it due to something else? Now, so we would need to do a very basic review, see what's your general posture like. If it's purely due to problem with muscles, right, which means poor paraspinal muscles, then very simply is strength training, muscular training of your back muscles. 2, if it's due to things like a poor nutrition resulting in poor muscle mass, or poor vitamin D resulting in poor muscle mass, these are the 2 things that also need to be topped up so as to prevent further worsening.
Thank you, Doctor. Next question. I have a chronic left lower back pain for many years already. It's more like I live and let die kind of attitude. May I know, is it treatable?
Okay, so lower back pain is a chronic problem. I also have lower back pain. So I think most of the time we need to first make sure that it is a lower back pain that's not sinister. I think we mentioned about the red flags initially. That means if your back pain has changed in nature to the point where you find that it is even affecting your sleep and affecting general function, I think that's a sign or signal to you that you need to see someone. 2, if you feel your back pain is also starting to be associated with leg symptoms. So to spine surgeons like us, leg symptoms like shooting pain, numbness, tingling, it is a sign of nerve compression. So once you also have that, that's something that we will encourage you to do something. So in essence, any lower back pain that has changed, worsened, affected general function should be visited, should be reviewed by your doctor.
Thank you. We've got a question from a sister here. For small frame postmenopausal women, how frequently do we need to do the bone mineral density test if there is a family history of bone fractures from falls?
So you should at least do one for baseline. And if thereafter you're already diagnosed to be osteoporotic, generally your physician should already be treating you. So in Singapore, we do treat osteoporosis both in the general clinics as well as the special clinics depending on the severity. And thereafter, once treatment is started, we do yearly BMD to follow up on progression or change, meaning we want to see whether there's any decline or worsening. Sometimes if you are started on what we call injectables for osteoporosis, we want to see if there's an improvement in BMD.
Thank you. Next question from must be a brother who is having sleepless nights. At 50-year-old, I did my screening and osteopenia. Does it mean surely by 70 years old, I most likely have osteoporosis? Should I be worried now?
Okay, so the simple answer is, if you're already in osteopenia, what it means if you look at your test result, there are 3 different colors in your test result. Green means normal risk, there's no increased risk for fractures. For osteopenic patients, you're at slightly increased risk for fractures. For osteoporotic, you're in the red zone. Red zone means very high risk for fractures. If you are yellow, it means you need to do something. Just like yellow card like that, you must do something now, okay? So please make sure you find out why is it that your bone quality is worsening. Is it because you don't take enough calcium? Is your body serum calcium low? Is it because you don't have enough sunshine? Your vitamin D level is low. And lastly, is it because you're too sedentary, you're not exercising enough, and your body is not responding to stimulus, and therefore your bone density is thinning out?
Thank you, Doctor. I think we're good on time, so we've got, I think, 5 more minutes for a few more questions. One more, closer to home, closer to everyday life. I have minor LBP. Must I refrain from carrying heavy loads, for example, groceries on a daily basis? Must I refrain from carrying that?
Okay, so I myself have a slip disc when I was in J2, and I have not. And I feel that I don't think we should be refraining from general activities. I think what's most important is you need to have, one, manage your own body's condition. You need to train and rehab back if you do have some lower back pain. 2 important things that needs to be done. One, of course, is please make sure your muscles are strong enough to sustain your activity. 2 is when you're doing your activity, a good posture is essential. This helps to prevent any injury and therefore prevents your back pain from worsening. Yeah.
Got it, Doctor. What age does one need to have the bone density scan done for both men and women? Okay,
so I think that was the first question we answered.
All right.
So generally, I think if you are menopausal and you want to find out, you can do that. For your BMD for postmenopausal ladies. For men above 60, you can if you want to. But if you have risk factors, as mentioned in the slides just now, I think you should be doing earlier rather than looking at your age group.
All right. Okay, the last 2 questions. I've got lower back pain for many years already. My spine has curved. How can I overcome the pain minimally and has to be safe for 70 years old, probably the age of the person asked the question, and is there any holistic or alternative treatments to cope with this condition?
Okay, so there are 2 kinds of curvature that we talk about in the spine. So if you look from the front portion, we have what we call a scoliosis or S-shaped curve. That means you are like tilted like this, okay? So there is the other curve where we are kyphotic and you are tilted like this, yeah? So we can see both kinds in the older age group in our clinics, but I think essentially the same thing applies for both the young and the older population. I think exercise is actually a very important part because we do lose muscle mass and bone density after the age of 40. The amount of muscle mass we lose after the age of 40 is 5 to 10% a year, which means if you don't exercise, we are looking at a downward decline. That means if you don't exercise, you don't have enough protein, your muscles are only just going to degenerate. And once you have inadequate muscle volume, you're unable to hold your spine up, you get chronic fatigue, you stand long, you sit long, you need to lie down because it's just too painful. So activity-related pain will then occur. So suggestion is, one, you definitely need to start moving. Use age-appropriate exercises. If you go to our Health Hub and Healthy SG, they have a lot of YouTube videos for the elderly to do exercises, even at home or outside. You can use very small weight dumbbells or use a chair. You don't really need to go to like specific places like a gym to really start exercising. Yeah.
Oh, thank you, Dr. Fong, for the tip. Last question. Elderly female recently suffered from fracture and an operation done. What is your opinion on taking, it's more of nutrition, taking Ensure and calcium tablets, or should she switch to another brand like, say, Duke-NUS Gold?
Okay, so Ensure is different, yeah. Ensure is actually for caloric deficit patients. So if you look at your Ensure packaging, be it the powder or the can of drinks that you have, it is usually prescribed by your dietitian if they feel you're underweight, they want to increase your calories for the day. They may not have high calcium, so it's different from your milk that you're talking about, yeah.
Oh, thank you, Dr. Fong, for the clarity, and that was Dr. Fong Poh Ling. And thank you for that insightful session. I hope all of you all learned something as well. I certainly learned a lot, especially on my posture, and I'm definitely going to start standing straight from now onwards.